everything he eats, and it sticks there in the throat.
Fred has been poorly for some time. He's been finding it difficult to keep anything down. But over the weekend, his health worsened, and his daughters decided he needed urgent care.
I've been down for x-rays to the whole of my body through the back, and now we're waiting for the system for what they find.
Good afternoon, A&E. Dr. Hamer speaking.
Unfortunately for Fred, his hospital visit comes at a time when it's under great pressure. The first of a 3-day joint walkout by junior doctors and consultants.
You always worry that maybe the service won't be there when you need it for yourself. We probably would have to wait longer for it, and people would have to be mindful of when they're calling on it and as whether they actually do need it.
The hospital must keep its emergency department open with Christmas-style staffing cover. I filmed in this hospital quite a bit in the past, including earlier this year on other strike days, but today feels different. It just feels much busier than normal. And it's only going to get worse as we head into autumn and winter. COVID cases are rising, flu season is weeks away, and winter will soon be here.
The thought of the strikes going to the winter period really is a worrying situation for us, and that's why we keep saying we need government and unions back around the table. They have to get to a resolution to this ahead of the winter period.
The waiting list is growing longer, patients are getting sicker, the cycle of pressure throughout the system is relentless.
There are patients of mine that have had to cancel who were unwell, and therefore, where we would have seen them and treated an outpatient, they instead turn up in A&E or go to the GP to putting pressure on the emergencies indirectly.
The A&E at the Royal Berkshire Hospital in Reading is also extremely busy. And here, every strike day comes with a cost to patient care and NHS budgets.
It does get expensive because we have to provide safe cover for patients who need our care in an emergency on any given day. It's cost us over £1 million in additional funding so far this year, and clearly that does have an impact on our bottom line.
Back in Preston, Fred's family are still waiting for a bed, but on strike days, patient discharges can take much longer. More evidence of the impact these strikes are having on every patient. Ashish Joshi, Sky News in Preston.